Hi, I'm Bill from Osborne Medical, maker of Rooke products. In a moment, I'm going to give you a quick in-service refresher on the Rooke BKA below knee amputation stump protector. At the end of the video, I'll have my contact information on the screen in case you have any questions. So the Rooke BKA stump protector is a device used to protect a patient's post-op BKA wound site from a bump or a fall. To date, I'm aware that we've had 29 reported falls of patients wearing the device on their BKA with no dehiscence. In addition to this protection, the Rooke BKA is great for contracture control. It provides rigid posterior fixation, and it's naturally warming to help boost perfusion. So the device is one size fits most. It can be custom fit by trimming. It's worn on the left or the right, so there's only one size needed to stock in inventory. I recommend the Rooke BKA be stocked and stored in the OR for the best application. Now, to put the device on the patient, go ahead and open the package. You have the device itself. There will be a waist belt, a package with an extender strip and a pair of scissors to do any trimming. There are also two distal end pads that we may or may not need, and an instruction sheet. So, at the end of the procedure, go ahead and wrap the residual limb as you normally would with regular bandaging and dressing. Open up the device, take the patella pad off of the device. It just attaches with Velcro, but set it to the side for just a moment. So with the device open, we now want to put the patient's residual limb in the device, and we want to get the patient's patella to line up in this middle patella window section here. To get the patella to line up here, I may need to use these distal end pads. So it's going to be based on the length of the residual limb that we have to work with. So to get the patella here, I may need to use 1, 2, or none. Now, most of the time I see either 1 or none being used. So we've got that here. Again, the patella lines up in this window middle area nicely. I take the distal flap, bring this up first. Now we have ample material to accommodate a wide range of sizes. If I need to trim this back, there are double stitching lines. Take your scissors and cut a section off until you get the fit that you need. And then you wrap with the Velcro. We're going to do something similar up at the proximal end. So again, if you need to trim some off, go ahead and do that. If you have a really large patient, you can take that extender piece and attach with the Velcro, and that will accommodate a larger size for you. So again, we'll wrap. I will then secure the straps and buckles. And adjust and tighten as necessary. So we've got all this fitted and sized. I've got the patella of the patient lined up here in the window visible. Now, to protect against the contracture, I want to take my patella pad. Now, I don't want to torque down on this really tight. I want to take this and place it gently and then wrap on the side like that. That gentle pressure is all that's needed to prevent that contracture. These are machine washable. The instructions are on the tab up here at the proximal end. Now here's a helpful pro tip for you. To help manage breakthrough bleeding, I like to take a breathable chucks pad. Take my scissors and cut the size that I need. Make sure there are no pleats or seams or anything, but then I will line the inside of the device with the chucks. And I also like to have enough material up at the proximal end so I can sort of drape it over like a waterfall effect. This is not perfect, but it helps make the situation more manageable. So, I mentioned about the waist belt earlier. You're not going to need this in the OR setting, but this does need to go with the patient when they leave you. So, if you're fitting the device to the patient, I would ask that you please take a Sharpie, write the patient's name on the belt or on the package. There's a label there. Now, to put this on, I'm going to come around to the front here. Take the belt. Goes around the waist. Buckle and adjust as necessary. Now this attachment strap can go on either side. You just slide it around to the side that you need it on. and then attach it to the device. This just helps keep everything in place. So that's the end of my in-service. If you have any questions, please give me a call, email me, whatever you'd like. We also have a Rooke AK stump protector. If you'd like to see that, please let me know. I really look forward to meeting with you guys in person again, but in the meantime, thanks again, and please stay safe.